ka tunat social welfare jok sarkar jala kalabu yakathong ha ka drug reduction elimination and action mission harangkat ke ïatreilang bat ka Indian Drug Users Forum bat ka Meghalaya Users Forum menta ka sngi kar pun rayu trek ujali warjar arpsau kalapan long ya ka multi stakeholder symposium kumsi benta ban kenmau ya the International Day Against Drug Abuse and Illicit Trafficking arjar arpsau havivanta Shillong. Hagrik sngi la don lang ru menteri badai pet ya katanat social welfare ba polong do bahag jingkran jung ulaong bahag jingilang kabadang sudep shen kila yakli bat yakren halor kawai kamat lak sorkar kan simkian banikun yak jing kharoi bat jing sapreng jong udrok uba pol ulaong bak sorkar kalapan ba kani kadai kakam da kiwai pat kirukam ban pensisya halor jing persang jong ka sorkar ban wanra kilat kilenti kumno banikun persya yo drop bat yak jing kerni bandi kian
to combat this persistent menace. The theme of the World Drugs Day 2024 is investment in prevention. It is a call to action that resonates deeply with our mission in Meghalaya. It highlights the crucial need to prioritize preventive measures as a foundational strategy to address and mitigate the challenges posed by drug abuse. Drug abuse is not just a personal affliction. It is a societal challenge that affects every facet of our community. It disrupts families, it undermines economic stability, and hampers social development. In Meghalaya, we are acutely aware of the challenges posed by drug abuse, particularly among our youth. The allure of drugs can derail promising futures and lead to a cycle of dependency and despair. Therefore, our commitment to prevention is the cornerstone of our strategy in combating drug abuse. By investing in promotion, we are making a commitment to the health and well-being of our citizens, especially our young people. Our goal is to create an environment where individuals are informed, resilient, and supported, thereby reducing the risk of drug abuse before it begins. We are also working on educational initiatives. Our prevention strategy includes comprehensive educational programs aimed at informing our youth about the danger of drugs. These programs are integrated into our school curricula and supported by community outreach efforts. By providing young people with accurate information and practical skills, we empower them to take informed decisions and resist the pressures that lead to drug abuse.
Health and human rights. There is a profound impact on health and well-being of our communities, leading to increased rate of HIV, viral hepatitis, overdose, and other related harms. It closes the door for those drug users and their family to openly seek help to access to harm reduction services, treatment, and rehabilitation. The report on magnitude of substance use in India 2019, published by Ministry of Social Justice and Empowerment, suggests that there is an estimate of 8,54,326 people who inject drugs in India, of which 1,49,866, totaling 18%, are from the Northeast India. Meghalaya is estimated to have a number of 11,420 people injecting with drugs. We need to understand whether we have enough facilities to accommodate this number of people and provide them with treatment options. The HIV prevalence among injecting drug use in India is at 9.03, which is the highest among any typology. Meghalaya has 11.48% of HIV prevalence among injecting drug users, which is above the national average of 9.03, and the second highest HIV prevalence state in Northeast observed among injecting drug users after Mizoram. Source of the report is from NACO Sankala 5th edition report. As we observe the World Drug Day with the theme, the evidence is clear, invest in prevention. There is a need to have effective drug policies grounded on science, research, compassion, and full of respect for human rights. Primary prevention policies need to be developed both at national and state level to empower youth and equip them with knowledge, skills, and resources to say no to drugs and become agents of change in their communities, advocating for drug prevention initiative and amplifying their voice in the conversation. We need to invest more on research to understand various behavioral and psychological issues faced by adolescents so as to develop policies planned to address their needs. Early intervention should be planned for people who are in their initial drug use so as to discourage them from becoming dependent on drugs and also minimize the harm associated with drug use. For those who are already dependent to drug use, we need to treat them on a public health perspective, as drug addiction is defined as a disease by American Medical Association and World Health Organization. There are thousands of drug users who have availed drug treatment service and are doing well in their life and are actively contributing back to the society. There is a need for collaboration among government departments such as Ministry of Social Justice and Empowerment, Ministry of Health and Family Welfare, Ministry of Home Affairs and Finance, faith-based organizations and other civil societies working on drug demand reduction and harm reduction services. It's important to consolidate what have been achieved and build synergies to address the gaps. We urge the government and various stakeholders to capitalize on community skills, knowledge, experience, and expertise by promoting peer community involvement at all levels and adopt bottom-up approach in combating the menace of drug use and drug use prevention. Thank you for your patient hearing.
I could see that the response to today's celebration is again enormous and encouraging. And at the when we last met at the State Convention Center, one point that was repeatedly made was that whether the government is serious about tackling the menace of drugs. Today, I could see a number of you coming back to another deliberation invited by Social Welfare Department, which means that the trust deficit has somehow been mitigated. We are coming closer to a point of realization. Because the last time around, I remember one of the leaders of the Torbashnongs asking us whether we are here just to have a cup of tea with you or do you mean business? I think today we have shown that we do mean business. No amount of developmental activities, no amount of investment in tourism, no amount of investment in the road sector can yield the desired results if all our initiatives are towards facilitating and creating infrastructure for a generation of drug addicts and alcoholics. It would defeat the very purpose of even having a government and a system of governance in place. So today, I'm happy that I could sense that guarded optimism which is evident in all of you coming here together. And more importantly, we have listed as a subject immediately after the vote of thanks a panel discussion where we the discussion centers on legal provisions and policy advocacy in regulating drug use. NDPS Act, PIT NDPS Act, where our panelists include a senior advocate, Srimati Trupti Tandon, senior advocate of the Supreme Court, and Mrs. Tashlin Kharpateng, District and Sessions Judge. A major gap in arresting the trend of the resurgence of drugs and the emergence of drugs culture in Meghalaya is the need felt by all stakeholders that somewhere there are gaps in implementing the law, that there are striking gaps that make it possible for people to get away with trafficking, and that the laws are such that they are more for the traffickers and more against civil society. I think it is very pertinent that we have engaged the intervention of legal experts to speak on this theme. I encourage all of you to pay attention to the presentations and also come up with suggestions, queries, and engage yourself fruitfully with the discussion. Friends, the fact that today Meghalaya has moved to a realization that we need to escalate, we need to elevate our engagement on the problem of drug trafficking and drug use is a timely reminder that society has the choice to either be a victor or be a victim of circumstances. We have seen that a society like Punjab, a state that had so much in terms of its youth potential, so much of its capability in the field of sports and defense, how it was gripped by the crisis of drugs, and almost every household had a victim, had a drug user, which fundamentally undermined and had the potential of destroying the resources of the youth. And that should act as a lesson to each one of us here. At one point of time, Meghalaya was a transit point of drugs and narcotics. But today, it is no longer just a transit point. Drugs have reached every nook and corner of the state. It is very important, and I make this plea to each one of you that we need to act, put our acts together. Let's not indulge in any blame game. If there are any gaps in policy making, any gaps in the way that the police, the home police functions or the Department of Social Welfare functions, do feel free to interact and point out those gaps and deficiencies to us. But it's very important for each one of us to claim this as our own battle. We are battling a menace that has the potential of destroying society for good. Therefore, I would urge each one of you at each level, whether as NGOs, whether as faith leaders, to constantly keep this in mind, that the future of this state, the future of the young generation is in peril. We must take up the cudgels on behalf of society. I reiterate that as a government, we do not claim to be the ultimate repository of all wisdom. We are learning from day to day. And today, if anyone can say that you could notice that there are rising incidents of drug trafficking, you would also look at the bright side of things, which is that government is also proactively pursuing these offenders, which is why the rate of recovery and rates has gone up dramatically. We want to upscale our fight, but to do that, we need each one of you to engage yourself actively and come up with all suggestions, ideas. As I said in the last meeting, there are acts and regulations that are already in existence. We need you to come forward. And the way the VDP in a decade back had fought the rising spurt of crimes in the capital town of Shillong those years, 15 years back, today that same institution has to be revived. And yes, I understand that there are groups that would like to proactively catch hold of drug traffickers and drug users. But then, please remember that it's a very sensitive subject and one cannot take the law into one's own hands, because ultimately doing that would be to the benefit of the drug traffickers and the drug users. The discussion that will take place soon after this address, I'm sure will unravel the intricacies of the law and empower you through your understanding of what is the correct course of action to take. But as a government, I would once again seek and solicit your support, because we need to come up together and ensure that we get rid and eradicate this problem. The sooner the better for each one of us, and we can do that through that core belief